This is a typical scene before dawn at one of Beijing's best hospitals. Hundreds of sick people anxiously waiting for the doors to open.
All of these people are standing in line waiting to see a specialist. Some of them have been standing since yesterday. It's now 6 o'clock in the morning and they don't know if they'll get in today, if they'll get in ever.
This is how difficult it can be to see the right doctor in China. Some patients hiring scalpers to stand in line for them, paying up to 20 times the price of a normal doctor's visit. Zhu Jiangwa is here for the third day, a determined son who's traveled all the way from southern China, some 800 miles, to find a doctor for his ailing father, who's staying at a hotel across the street. We just hope he can be cured, he says. When the doors open, it's a chaotic scene. Security guards don't want us to see. Many are turned away. There simply aren't enough doctors. But it's the Jews' lucky day.
Okay, you're number 5. That's a good number, right?
Yes, he says, we've got an appointment to see one of the most prominent thoracic surgeons in China. He takes the good news across the street, where his father is resting in a local hotel. I just keep coughing, the 59-year-old says. Our local hospital isn't good enough, but my family can't lose me, so I chose to come here. It's just the way it is here, his children say. China has many people. It's no secret healthcare in China can be seriously limited. The life expectancy for the average Chinese person is just 73 years old, compared to 78 in the U.S. and 82 in Japan. While basic health care like vaccinations is easily accessible in China, higher-level care can be difficult, especially in rural areas. The Chinese government is investing $130 billion to improve the health care system, but doctors say it will take years to reform.
About people they can't access it, and when they do, they have nobody helping them to navigate, so they don't know where to turn to frequently.
Turns out the Zhu family had to go to yet another hospital across town to get the necessary treatment.
What have the doctors here told you?
My father has late-stage lung cancer, he says. It spread to both lungs, his lymph nodes, and his bones.
Do you think that if there had been better medical care in Zhejiang, where you're from, that your father's cancer would have been caught sooner?
Yes, he says. I think so. Their insurance will cover at most $5,000, but treatment will cost tens of thousands more than that. A massive burden for a son who's already walked a long road with only uncertainty ahead. Emily Chang, CNN, Beijing.